Good morning, everyone. Bonjour tout le monde. It has now been over 1 month since we last officially heard from our Chief Medical Officer of Health. His last press conference was on November 14th. Until now, we have heard nothing. The Minister of Health has repeatedly contradicted his advice. There was a masking fiasco. Pediatric hospital performance has deteriorated. Inter-hospital transfers are at record levels. And air ambulance flight crews are now traveling with their passports in anticipation of transfers to the United States. The Red Cross has been deployed in our nation's capital. All this with zero updates from the Chief Medical Officer of Health. Now, this is more important than ever because we have just seen a tidal wave of RSV batter our pediatric hospitals, and we're now on the cusp of a tsunami of influenza. We know already that CHIO is reporting a staggering increase in lab-confirmed cases of influenza in children, with nearly 1,000 cases identified since September. That's the tip of the iceberg. They admitted 73 pediatric influenza patients in November, their second most ever, behind only a single month during H1N1 in 2009. We need to learn from lessons of past pandemic waves and from RSV. We have seen what RSV is doing to our pediatric intensive care units. As I have presented multiple times before, through no fault of our healthcare workers, we are now seeing the worst healthcare system performance in our province's history, with record wait times, record emergency department lengths of stay, and record ambulance offload times. We have a shortage of children's Tylenol, a shortage of healthcare workers, a shortage of intensive care unit beds, and a shortage of leadership. What we need right now is a strong and coordinated public health campaign. But this government would rather ignore the problem than address it. This government is reactive, not proactive. And when they do react, it is when disaster is already on our doorstep. For example, when it comes to influenza prevention, we get nothing more than a passing comment from the Premier and the odd tweet from the Minister of Health. We need to find new ways to increase vaccination uptake, and we needed to have done it yesterday. Now, we're about to go into the holidays, and there is no updated guidance about how we can all protect each other as we head indoors. How can we keep each other safe, especially with looming Christmas parties? What should we do if someone at home is sick, but we're feeling okay? What are the options to access medical care during the holidays? We all know that healthcare workers desperately need a break and often take a pause over the holidays. Where do we go if we're not feeling well? Because the answer cannot always be the emergency department. Additionally, people need to hear about immunizations. They need to learn about antivirals like Paxlovid. They need to understand how to get them. And they need to hear it from Ontario's top doctor. I also want to say that there is an antiviral treatment for influenza called oseltamivir or Tamiflu. The Public Health Agency of Ontario recommends this medication in the right population, but it has to be administered within 48 hours. We need to know what the government's plans are for this now, while there may still be time to implement them. And we need to hear it from the Chief Medical Officer of Health. He needs to provide an update on where we are right now, how to brace for the pediatric influenza spike without calling in more NGOs like the Red Cross, and how to prepare families for the holidays. We have 1 week left before the break. In fact, less than that, because Hanukkah begins this weekend. This government needs to move. Finally, I would like to take this opportunity to invite everyone, especially parents, children, and seniors, to get their flu shot as soon as possible. It might save a child or senior from getting sick. It might save them from being admitted to an intensive care unit. And it might save our healthcare system from plummeting even further. With that, I would like to take your questions.
Dr. Moore was on CBC Radio this morning, and he said, among other things, that he's concerned that not enough people are masking on public transit. What do you make of that admission from him?
You know, Number one, it's great that he was on the radio this morning, but I'm standing here, and this is where he needs to be. He could call a press conference, and this room would be entirely full with reporters who would be able to communicate the messages and the answers to many of the questions that I've asked. In regards to his admission that his calls for masking are not working, again, he's admitting that it's too little too late. He should have been taking action to increase masking uptake weeks, if not months ago. Day after day, week after week, we see growing evidence of this government's failure to implement public health protections and increase the capacity of our healthcare system. And they always come out afterwards and either admit that they could do something more, or more often than not, they blame it on someone else. In August, Sylvia Jones blamed the poor ER performance on healthcare workers being on holidays. Now it's, the people of Ontario aren't masking up enough. Well, this is on the Chief Medical Officer of Health, on the Ministry of Health, and on this government. It's an admission of their failure. But the patients of Ontario have been noticing and feeling that for a long time now.
And he also said that we're seeing a decrease in people getting humanized. But at the same time, he says all the public health units are campaigning and telling the public to get vaccinated. So what's missing? Why are people not getting more vaccinated?
I think the first thing is this government has a narrative that everything is okay. They've got a plan. They're taking care of things. They're getting it done. And that affects people's perception of risk. If they think that everything is okay, if they hear that everything is okay, then we all conduct ourselves accordingly. But if the government came out and said, our hospitals are really struggling, unfortunately, we have kids who are in adult ICUs, and we need everyone to do whatever they can to support our healthcare system, then people would hear that and they would feel, motivated to come in and do their part. But for as long as that the government says everything is okay, people will continue to appropriately behave as though everything is okay because they count on their government, to give a frank assessment of how things are. But, I've called multiple times now for a proper public health campaign. And the way I imagine it is we could take ourselves back in time to May 2022. And you remember the Ford campaign as they were seeking election? You couldn't not hear them on the radio. They had jingles, they were out. The message was the same, we're going to get it done. I wish they could turn that same ambition to get elected in May 2022 towards helping all of us get vaccinated as soon as possible. The message needs to get out. Needs to get out through multiple different forms of media, on the radio, on television, from the Chief Medical Officer of Health standing here. It needs to be in multiple languages because not everyone speaks English or French. In fact, some of our most marginalized and disadvantaged populations don't speak either of those languages. They're the most likely to have poor outcomes from influenza and COVID-19. And they're the ones who are least likely to hear the current messages right now. So all of those things need to be addressed.
Is it too late for that, though? I think a lot of people are kind of in that holiday mode already, maybe not paying attention to the news, not paying attention to TV commercials, radio commercials, the way they might have been a few weeks ago. Is there still room to make a difference there?
Absolutely, there's still time to make a difference. Make no mistake about it. It would have been far more effective if this had been done earlier. I think Quebec started their vaccination campaign in August or September. We could have started weeks, if not months earlier. But the reality is that if we can get thousands, tens of thousands, hundreds of thousands of people vaccinated now, it will absolutely make a difference. We all have a huge part to play. And getting vaccinated as soon as possible is one of the most important things that we can do.
Why does the government need to say it? Do you not think that people are taking what frontline doctors, medical staff have been saying about the state that their hospitals, especially in pediatric care, are in? Is that not sufficient?
Our healthcare workers need help. They're doing their best. They can't be the only ones staffing our hospitals, doing public health, guiding the public. The government has a role to play in supporting the work of healthcare workers and amplifying the efforts of healthcare workers. There's one doctor who's not very prominent, surprisingly not prominent, in promoting vaccinations in public health campaigns. And it feels like that one doctor is the Chief Medical Officer of Health, who could be standing here, who could be offering weekly updates the way, the way it was done during earlier phases of the pandemic. The healthcare workers are doing their best. There's a shortage. They're burnt out. We need to help them. Patients need to help them. And our government needs to help them as well. And using the unique resources of government, the communications capacity, even the authority of the government, would go a long way to amplifying the efforts of our healthcare workers and helping our healthcare system.
Do you feel that the government is making a political choice here, not to downplay this situation, to try to move on from the pandemic at all costs?
It certainly feels like it. In anything even healthcare related, there are costs and benefits. The costs can be measured, especially during the pandemic. The costs can be economic, but they're measured in people's lives and in their well-being. And the way this government perceives it, they're also measured in terms of opinion polls. And what I believe we've seen is an effort to sort of obfuscate, be obscure, and to not release information that articulates the scale of the crisis that we're in. And I think one reason they're not keen to highlight that is because the crisis is their fault. As I mentioned before, we're seeing the worst healthcare system performance in this province's history. That's not something that they want to highlight because it's something that they will be held to account for and should be held to account for.
Is it possible that people just don't want to hear it anymore? Is everybody done with this? We've run out of steam to keep trying to deal with the pandemic, the flu is not new. It's not new and scary and never seen before. It's just influenza. It comes every year.
We certainly have to move away from fear mongering. We have to be sensitive in the nature of our communications. But everyone, patients, the people of Ontario, doctors, everybody wants to be healthy. And, and it's incumbent upon us to help provide guidance about how to be healthy. If we do it in the wrong way with finger pointing and finger wagging and that kind of thing, it's not going to resonate. It will drive people away. And I'm certainly not calling for that. But there has to be some transparency. And what I know from, when I speak to friends, family members, when I speak to my constituents, many of them are surprised. For example, I can tell you, my own parents, if they get COVID, they wouldn't know to get an antiviral medication that could save their life. They want to know that. They'll know that because I will tell them. But if they don't have a son who's a doctor or an MPP, the vast majority of people that would benefit from these antiviral therapies won't know about them in the first place, let alone how to get them. That's not, that's something that people want to hear. And that's something this government is not sharing.
Doctor, can kids take Tamiflu? Or is that only for adults?
Yes. Yeah, it's available for children as well.
How low would that, what age group would that go down to?
I would have to remind myself, yeah.
We have a caller on the phone.
Thanks, everyone.
Thank you.
Yeah.